taking notes. We are using this WebEx platform, and the participants are muted at the beginning, and there may be time for oral discussion, but um, uh, uh, most likely we will pick up questions in the chat box. So if you have any questions, please open the chat box and post your questions. And these will be dealt with in the panel discussion session as much as possible. But if there's any time left for oral questions, you can raise your hand. Um, and also, please note that this session is recorded and broadcasted on the YouTube. With this, I will stop sharing the, my screen. And hi, Ashley. I think I'm glad that you joined. I was just sending you an email. So I think Moses, yes, you started the recording. So I think uh, we can start. Welcome again to the participants and to all the panelists. Uh, this is a, the second of a Minamata online session uh, um, related to the synthesis papers from ICMGP. I think I will uh, explain it in my using my slide. But first, before doing that, I would like to extend my sincere gratitude to all the experts who joined today for a very fruitful discussion on Mercury health risk communication. So I think I will start with my uh, first slide. Hang on, please. So, this session is uh, convened by the Minamata Secretariat and ICMGP and attended by Neil Basu, Eva Krumel, Andromachi, Ashley, Irina, Hashka, Joy, and myself. I will introduce these speakers when I invite them to speak. And today's session is about mercury health risk communication. Um, so uh, the Minamata Online started in 2020, and we are in season 3. The science stream of the Minamata Online is co-convened by the ICMGP, and we decided that the first 4 sessions of the Minamata Online season 3 science stream should uh, uh, be organized around ICMGP synthesis papers, and this is the second one. The first one was on HGM, and this is second one, health risk communication, and then we are going to have Mercury in southern hemisphere and Mercury and climate change. Um, so this is the full list of ICMGP synthesis papers, and this was modeled on, as I understand, from the experience in the 2018, where synthesis papers were published in Ambio. And I understand that these 4 or 5 papers will be published in February next year. Before turning to Joy, I like to provide a bit of background from the Minamata Convention perspective. Of course, Minamata Convention is, as you say, a global treaty to protect the human health and the environment. And the protection of the human health is included in its objectives in Article 1, and it has a specific Article 16 of health aspects that encourage parties to develop strategies for uh, uh, health strategies and work on the prevention of occupational exposure, healthcare services, and so on. And also the convention provides that the conference of the parties will collaborate and consult with WHO and ILO. And we are very glad that experts from WHO and ILO are on board today. So with this, I think I will turn to Joy about explain a little bit about the ICMGP.
Good afternoon, good evening, and good morning. And thank you, Aisaku, for this. And thank you also for arranging the event today. And so this of course happens at the back of the very successful conference that was held in July this year, the virtual one, ICMGP 2022. And so now we're preparing for the next one for Cape Town, that will be held in Cape Town, and the dates is the 21st to the 26th of July 2020. And so that is basically work in progress. But my next slide, Aisaku, thank you. So the conference co-chairpersons, there will be three co-chairpersons for the event. Which includes myself and then Dr. Linwell Martin, who was the chairperson for the 2022 conference, and then Prof. Vernon Somerset, who's the co-chairperson of the Scientific Steering Committee. And during the first quarter of next year, 2023, we will confirm the EXCO, and so those circles is basically to be confirmed, and then also the scientific steering committee. So definitely from the Mercury community, we will approach, of course, individuals who to be part of the scientific steering committee, but that will then also happen in 2023. Thank you, Aisaku. Next slide. And so again, these are calls that we will make during next year, which is basically the Lifetime Achievement Award. As you know, Rob Mason is the current recipient of the Lifetime Achievement Award from 2022 onward to 2024, and then the Emerging Researcher Award. So that call will also be made, and then also the call for the Mercury workshops will also be made in 2023. That information can currently be found on the ilmexhibitions.com for Mercury 2024. Next slide, please, Aisaku. And then just to basically welcome you already to Cape Town. There's lots of attractions, but of course the event will be hosted at the Cape Town International Convention Center in July 2024. There's lots to see around Cape Town. We've got we've got a GORE station at Cape Point, and all those in the blocks. I'm not going to go through it in the interest of time, to hand over back to Aisaku and to the panel, and just to say thank you also to the panel for agreeing to do the synthesis paper, which of course comes from the event, that the Mercury conference that was held in 2022. And so over to you, Aisaku. Thank you once again.
Thank you, Joy. And then I think I would like to jump into the substance, and I would invite Professor Niladri Basu of the McGill University and the lead author of the synthesis paper for ICMGP to set the scene. So, Dil, over to you.
Thank you, Isaku, for that introduction. Can you see my presentation?
Yes, very,
Okay.
very well.
So I had the privilege of being the lead author for the plenary, human health plenary in the recent ICMGP. And the title of our paper and our presentation was Our Evolved Understanding of the Human Health Risks of Mercury. And the tagline for today is that risk communication is key. So this just gives you a sense of who the authors are and the diversity that we bring to such an endeavor. We come from different parts of the world in which we experience Mercury in very different ways. Our training, our professional background is also quite diverse. Fortunately, today, besides myself, Arena, Ashley, and hopefully Milena will be able to join, so you'll be able to hear from multiple authors of this paper. So in terms of a background to our plenary mandate, remember that the Minamata Convention is really driven by human health concerns, such that Article 1 emphasizes the need to protect human health. As we read through the convention, there is mention of vulnerable human population groups all throughout the convention text. And we know that mercury is a risk to such human populations, but there remain generalizations and misconceptions in the field amongst fellow mercury scientists, amongst stakeholders in the field, and even amongst the evidence base. We felt it was important that now that we have the Minamata Convention and the convention focuses on human health, that we should really take a deeper look at some of the misconceptions and generalizations in the field and try to illuminate these a little bit better. So in terms of doing this, the objective of the paper was to help our fellow mercury scientists and stakeholders of the Minamata Convention and mercury pollution in general. We wanted to help these groups to gain a deeper and also more holistic understanding of the true human health risks associated with mercury. So what the paper did is that it reviewed how our scientific understandings of mercury's health risks have evolved over time. And we did this through a scan of various case studies around the world. And in doing so, our conclusion is really that we need to consider very deeply that there's tremendous socio and environmental factors that vary around the world, and that such diversity needs to be considered when conducting health studies, but also when communicating the risks associated with mercury. So the paper was organized on a chronological basis. We looked at key events and key understandings on a 25-year cycle starting in 1950. And if we look at the evidence base between 1950 and 1975, this is a time in which mercury health researcher was dominated by occupational medicine and one that focused on acute poisoning events. If we think about risk communication during this era, it was largely a one-way form of communication that was focused on the hazard, the mercury poisoning, and focused on just giving users the facts and assuming that users would take up this information and act upon it. From the 1970s into the year 2000, our understandings had started to evolve. We started to focus more on toxicological investigations that involved cohort studies or studies on groups of people that are highly exposed to mercury. The research community started to focus on studies that were more long-term in duration and started to focus on exposures into populations from chronic exposure to seafood consumption. And health outcomes started to focus on more subclinical and subtle effects, largely initially focused on neurodevelopment. Risk communication during this era also started to evolve. We started to see, especially closer to the 21st century, so starting in the 1990s, that the way that we communicated risks started to be a bit more two-way. So stakeholders and communities would start to engage with those giving the risk communication and the scientists involved. We also started to consider more diverse perspectives. So moving away from toxicology and medicine, we started to consider cultural dimensions and nutritional dimensions. In our paper, we also mentioned that the understandings that were realized in this area tend to drive most of the understandings in terms of human health impacts. Nowadays, however, we start to see that the sort of the populations that come into contact with mercury and the risks that may arise because of this are way more diverse. So epidemiological and cross-sectional studies have started to uncover that there are a range of groups around the world exposed to a range of diverse settings and sources, such as ASGM and mercury-containing products, that really expand our understanding of the human health impacts of mercury. We start to see studies expand across Asia Pacific region, Africa, and Latin America. We start to focus more on human biomonitoring, and we start to see that the effects of mercury can range from the molecular all the way to the organismal level. In terms of risk communication during this era, nowadays, We have a range of communication tools that are available to us. And what we can do is we can match these risk communication tools with audiences to make sure that they're fit for purpose. But we're also starting to see that some of these risk communication tools can also promote misinformation. So it's important for us to be aware of the diversity of risk communication approaches available and be able to manage them effectively. We've also learned very importantly in this era that relationships matter, that the relationships between the communities and those delivering messages matter, and that trust is key to proper risk communication. As we move into the future, we feel that the science of mercury pollution and risk assessment will be more systems-based. We feel that integrative understandings will start to look at mercury stress in terms of other co-stressors that are either chemical or non-chemical. And we feel that the field will start to focus more on public health approaches that prioritize prevention and interventions. So in terms of risk communication, we feel that risk communication during this era will become more and more personalized, and it'll also emphasize reflexive practices in which we continuously learn to listen and improve how we deliver risk communication messages. So this is necessary because as we articulate in the paper, that risk assessments of mercury can vary tremendously. So in the paper, we detail how different forms of mercury can vary in terms of their source, in terms of their exposure routes and populations affected. Similarly, we argue that the risk assessments for dietary exposures differ from inhalation exposures, and these differ from dermal exposures. That risk assessments that are focused on tuna will be different from other food items, and even within a particular food class, such as tuna, for example, that the risk assessments can differ. We clearly know that children are not adults and males are not females, and these require different risk assessment practices. We know that rich are not poor and healthy are not sick, and so on and so forth. So all of these complicate the scientific aspect of risk assessment, but we can argue that they further complicate how risk communication is done. So for risk communication to be done properly under such diverse settings, it needs to really require that one integrate cultural, nutritional, economic, regulatory trust factors into the communication messages. And again, culture, nutrition, economics, regulations, these vary tremendously across the world according to different contexts, so on and so forth. We need to continue that two-way dialogue with meaningful, understandable, and actionable messages also continue. So in terms of takeaways from our health plenary work, again, we were motivated by this notion that we tend to generalize and misrepresent mercury risk in scientific and policy arenas. So we wanted to make clear that risk is very context dependent. This is important because mercury pollution continues to complicate situations of societal value. So we know that fish consumption is really important for food security, but unfortunately, a lot of fish have trace levels of mercury in them that pose health risk situations. We know that ASGM is important for economic development in many communities. Unfortunately, mercury is used in ASGM. And we know that dentistry and dental practices is really important for oral health, but there is the use of amalgam in certain communities that complicates risk communication messages. And all of these are important and all of these vary worldwide. So in the paper, we argue that operationalizing the convention will require those that are involved in the convention and stakeholders to really gain this empathy and understanding of such diversity. We can then take this a step further and then argue that risk communication requires even more empathy and understanding. And as we're going to hear in the presentations coming up, that things such as risk perception, trust, language and literacy, cultural norms are very, very important in risk communication. So with that being said, I'll stop here. If you have questions, feel free to put them into the chat box or email me. I can convene with the other co-authors and get back to you. Keep an eye out for a publication in Ambio, and thank you for your time.
Thank you. Thank you, Neil. And I think your paper have given us very good important lessons for against over generalization, and it is quite challenging for us as a global convention that is really a generalization of measures, the policy measures. So I think this is a very good topic for the panel discussion. Thank you very much. And then I would like to invite three key speakers. The first one being Dr. Eva Krumel of the Inuit Circumpolar Council, and she's lead author of the chapter on risk communication in the recent AMAP assessment. Over to you, Eva.
Thank you, Isaku, and thanks for asking me to present here. I'm going to share my screen and start the presentation. Presentation mode, so I hope you can all see that okay. So,
yes.
Excellent. What I'm going to talk about is the work that we did as part of the Arctic Monitoring Assessment Program, and I'm working for the Inuit Circumpolar Council. We had a chapter on risk communication, the last AMAP health assessment, and actually also the previous one. This is work that has been done by a lot of authors. We had a lot of contributing authors doing great work on this. We also had data and information contributors and a lot of reviewers who provided great comments and helped greatly to improve the chapter. Just for those of you who are not familiar with the Inuit Circumpolar Council, which is the organization I work for, it is an indigenous organization, international indigenous organization, representing the around 180,000 Inuit who live in the circumpolar Arctic, in the countries in Russia and Chukotka, in Alaska, in Canada, and Greenland. And ICC has offices in all of those countries. The office that I'm affiliated with is ICC Canada, and the office is in Ottawa. I'm going to mainly talk about, obviously, the contaminant part of ICC's work, and it's very interesting how ICC is doing this work. ICC is involved in the Northern Contaminants Program in Canada, which is funding ICC's work on contaminants here in Canada. ICC is also involved with the Arctic and Monitoring Assessment Program. It's one of the permanent participants, and as such is really involved in contributing to the assessments that AMAP is doing. And all of that information is then also being used in international agreements, for example, of UNEP and the Stockholm Convention on POPs and the Minamata Convention on Mercury. And the idea is that those activities then can lead to decreasing contaminant levels in the environment. So the Minamata Convention, as Neil just mentioned, notes the particular vulnerabilities of Arctic ecosystems and indigenous communities, and particularly because of the contamination of the traditional diet. And that is very important to realize, because indigenous peoples in the Arctic are impacted by contaminants that undergo long-range environmental transport, such as mercury, and then it bioaccumulates in the Arctic food web and can reach very high concentrations. So health effects have been measured, and at the same time, the traditional country food that indigenous peoples eat in the Arctic is extremely vital for health and well-being, and it can easily be replaced, or can actually not be replaced at all, by other foods. It also has a great cultural importance. So when it comes to how to act on contaminants in the diet, obviously risk communication is a first line of defense if health officials try to reduce the risk of contaminant exposure. But at the same time, the experience that particularly we in Canada have been making is that it is really difficult to communicate contaminant risk appropriately. It's a very complex undertaking. And then there are also things that a lot of people do not necessarily think about, where we are not just talking about clinical risk communication, but also in the broadest sense. And I'm going to get into that with an example of the experience that we had also during the negotiations of the Stockholm Convention. So we have to think about that messages that might be delivered at a global place, for example, within UNEP or in conferences, and that something that you're transmitting to a global audience is actually making it back to people who are directly affected by the information. And ICC had some experiences with that about 20 years ago when the Stockholm Convention on Persistent Organic Pollutants was negotiated. And ICC delivered messages to the global audience, such as Inuit are being poisoned by all of those contaminants. At the same time, locally, Inuit were being told that their traditional diet is the best food to eat, it's the healthiest food. And that is definitely true. It's just that the nuances get often lost when you talk to different audiences. But because of the global nature of communication nowadays, you can send very mixed messages, and that is very important to keep in mind. So when the Minamata Convention was negotiated, ICC was very active during the negotiations to outline how Inuit affected by mercury in their traditional diet. And this time around, ICC used health advisories from the Canadian Inuit regions during the negotiations to highlight how Inuit are affected by mercury in their traditional foods. And that was also interesting to note that some countries during the negotiations approached us and said, well, you could deal with mercury in the traditional diet by just doing risk communication and telling people they shouldn't eat it. And that's not easily possible, and actually should not be attempted as a long-term solution. So it is really important to transmit to people that we need to get rid of the contaminants and not try to deal with the problem by just communicating the risk. So now I'm going into the content of the AMAP assessments, and the last one that that was published in 2021 is basically an update from the one that the chapter that we did in the AMAP assessment from 2015. And what we noticed in 2015 is that we had actually we were missing information from a lot of the countries with regards to national communication efforts. And so we added more information on some of those countries that we have been missing before. We also had noted before that there's not a lot of information about risk communication evaluation. So how did the messages actually were received? Did they actually make a difference? So we updated a lot of information on this. We also had noted before that there is not a lot of information about social media use in risk communication, and we added an example. And then we also added some new information about implications of international communication, which then reaches local audiences. And I don't have a lot of time, so I just mentioned some of the key findings from the last assessment. So in most Arctic countries, it's really interesting that the emphasis is actually not on risk, it's on the benefits. So and that's a very important message, that it shouldn't be just doom and gloom. It's really important to highlight the importance of the nutritious diet, and basically all of the Arctic countries outline that it's really important to eat the traditional foods, and it's really important to eat fish because it has a lot of nutrients. Most Arctic countries only have restrictions or guidance with regards to the foods that are based on mercury, but some countries also have some guidance based on PCBs, etc. There is still data missing on the effectiveness evaluation with regards to risk communication, and that is something that really should be done a little bit more. Then there's a lack of information on risk communication for indigenous peoples in the Arctic countries other than Canada. We have a lot of information in Canada. We don't really have a lot that we found for other countries. And then very important that if risk is communicated in the Arctic, it needs to be developed in partnership with the affected people. And it really needs to involve the local health authorities and indigenous knowledge holders, because they really know what works and what doesn't work, and what they're eating, and what maybe alternatives there might be. And then, as Neil already mentioned, the trusted relationships between all of the involved parties is really paramount. It's super important, because if there's no trust, then the message will be definitely not having an effect, or might even have negative consequences. So overall, we found that communication needs to be very targeted. It needs to be regular, not just one message, but it really should be going on over a long time. Very clear, timely, and personalized. Should be well balanced and take into account the cultural aspects, and particularly the benefits of the foods. Centralized and alarmist messages which contradict cultural values of local audiences can result in confusion, fear, or inoculation effects. So they can have very negative consequences. Social media can be a useful tool, but it needs to be properly managed, again, because it can lead to misinformation, disinformation. So it really needs to be managed. And overall, as I mentioned before, communication of contaminant risk is a very complex undertaking, and it's not a sustainable solution to ensure that low levels of contaminant exposures can be reached. So overall, we had a few recommendations. As I mentioned before, risk messaging needs to be developed with the members of the affected population, and it needs to really be customized to the intended audience, and it needs to be culturally appropriate. Some studies found that focused dietary advice coupled with hair mercury analysis can be successful for targeted groups, for example, pregnant women. And when doing the communication, it's really important to do proper planning. Sufficient time is allowed for the process, which can really take long. As I mentioned before, it's not just a one-off thing. So sustained continuous communication is needed, and multiple channels should be used. And then to really know if the message was retained and is really making a difference, there is follow-up required, and to see how it actually worked and if it worked at all. And then overall, institutional capacity is really needed to allow for those sustained activities. Really important is also to notice that the above recommendations are likely addressed automatically if a co-production of knowledge approach is used in the research. And in case people do not really have an experience with how to really do co-production of knowledge approaches, or how to equitable and have equitable and ethical engagement, ICC has developed protocols on equitable and ethical engagement, and there's a lot of information about co-production, etc., on ICC's websites, also on ICC Alaska's website. And for the AMAP assessments, you can go to the AMAP website. There's also the Mercury assessment that was published in 2021, and it includes a chapter on indigenous priorities and perceptions, and that also has a lot of information on things like co-production and communication. So I'll leave it at that. Thank you very much for your attention, and if there are questions, I'm sure I can answer them later on at some point.
Thank you. Thank you, Eva. And you point to the challenges in the effectiveness evaluation, and we are very grateful for your contribution to the Open-Ended Scientific Group of the effectiveness evaluation of the Minamata Convention. Yes, this is a very challenging issue. How you what effectiveness means in terms of the risk communication or public health strategy where Minamata Convention tries to mitigate the environmental change from the emission release of mercury, and then perhaps the risks communication strategy may be something like adaptation thing. So yes, it is very challenging, and this is a very good. This may be a good thing for the panel discussion. So thank you very much. Now, I would like to invite Dr. Andromachi Katsunori of Cyprus State General Laboratory, who's going to speak about the HBM for EU, human biomonitoring for EU.
Thank you,
Andromaki, yes.
Isago. I'm going to share my screen. Can you hear me and can you see the presentation?
I see the PowerPoint mode. It's not the presentation mode. Yes, it is. Now we see.
Okay. I will be presenting some of our experiences in the frame of the European Human Biomonitoring Initiative, a partnership of the European Commission, 28 countries, and the European Environment Agency, and especially some results from the HBM for EU study, which aim to control prenatal exposure to mercury by communicating appropriate advice for fish consumption to pregnant women. And in the frame of HBM for EU, I had the role of the chemical group leader for Mercury. I led the task for communication with participants, as well as the coordination of the HBM for EU mom study. The study was designed as a randomized intervention of pregnant women, and the objective was to develop an appropriate communication strategy with suitable fish consumption advice, which were then communicated to the pregnant women, and to basically try to also capture a lot of information with regards to the associations between fish consumption in different countries with the levels of mercury contamination. So we designed a study with participation of 5 countries in different regions of Europe to capture these differences of fish consumption. We had Cyprus and Greece from the southeastern part of Europe, Spain and Portugal from the southwestern part, and Iceland from the Arctic. And the study was designed in a way to address several policy level and issues. So we wanted to have the capability through human biomonitoring to characterize the risk and to also create a frame for communicating the results to those appropriate for management actions at the policy level, but also in the level of healthcare providers and citizens, particularly the pregnant women. So this is the study design. The study recruited pregnant women through their healthcare providers, and this created opportunities for the engagement of the health sector. We had a minimum of 120 pregnant women from each of the 5 countries, and the study took place in 2 phases. The women were recruited in early pregnancy, at which time they provided a hair sample for mercury assessment, as well as a lot of relevant personal information collected in interviews. At that point, the participants were split into a control group, which continued with the standard care they received in each country, and an intervention group, which received the HBM for EU advice we developed for the consumption of fish during pregnancy. And towards the end of the pregnancy, we repeated the measurements of mercury in hair, as well as the collection of relevant personal information from each participant. One of the issues we wanted to address by designing and implementing the study was to create a frame to collect and share harmonized, quality assured human biomonitoring data for risk assessment on mercury and for the management and communication as well. So one of the key issues was to harmonize and assure the quality of the results. We developed several tools, some of which you can see here. We had targeted questionnaires in order to help us understand the determinants of mercury exposure, and with a lot of focus on the fish consumption patterns of participants. as well as the sharing of data, addressing ethics, statistical analysis, data interpretation, and so forth. And we utilize the train-the-trainer approach in order to create capacities in the countries, but as well as into engaging healthcare providers and creating learning opportunities for them. So, as I mentioned, a major objective of the study was to engage healthcare providers in this whole exercise. And of course, we also engaged directly with the pregnant women as participants. The study took place in the course of just 17 months, from October of 2020 through spring of 2022. So this was over the COVID pandemic. And actually having a model that engaged the healthcare providers helped us to continue with the implementation of the study despite the pandemic. But also the engagement of healthcare practitioners was very important because we built on the trust that the women had for their doctors. And we also positioned ourselves well for sustainable use of the results in medical practice. So the doctors, depending on the model that each of the 5 countries used, were engaged in the recruitment of participants, samplings, as well as the communication of the results. We assessed the motivation of medical doctors to participate in the study, and the primary reason was to provide scientifically advised, suitable advice to patients. And with regards to the motivation of women to participate, the most important factor for them was to protect their children, their baby, but also the trust they had in their doctor and the organizers of the study. So I will show you some of the results to highlight how human biomonitoring can be used to create appropriate messages for pregnant women. Here you see the results from the first phase of the study. You see the exposure of women from the 5 countries to mercury in here, and the bars show health-based guidance levels. And what you can see is that there is a range of exposures in the 5 countries, with the highest exposures seen in Portugal, followed by Spain. And you can also see that some women exceed the guidance values. In fact, 12.5% of the participants exceeded the safety level of the European Food Safety Authority. And the other thing I would like to point out is that we have data to compare some time trends with respect to the exposure of women going back about 10 years. So if you compare the results of HBM4EU mom to those we obtained from the DMOCOF studies, we see that there was a decrease actually in the levels found in Spain compared to 10 years ago. And perhaps this has to do with the fact that Spain, since the time of DMOCOF, developed a fish consumption advice at national level, which may be helped because at that time, Spain was the most highly exposed country out of 17 European countries. So now with regards to what contributes to the exposures to mercury, our results show that factors associated with the exposure primarily concern how often fish is consumed. Those who consume fish 4 or more times per week had considerably higher levels of mercury in the hair, but also the types of fish that are consumed, which, by the way, differ, of course, across the different countries, which makes it very important to have studies like this at the multi-country level. We collected a lot of information about the different categories of fish, as well as specific species, individual species. And in addition to that, we collected information on the origins of the fish, if the women could tell us this type of information, as well as the seasonality. And the other aspect, which is very important, is whether women are aware about any fish consumption advice. And very importantly, even if they are aware, do they follow it? So this gave us a lot of insights as to how to tailor an appropriate communication strategy for fish consumption in pregnancy. We also collected a lot of information by interviewing the women using standardized questionnaires. And I would like to point out that with regards to when to provide fish consumption advice, as I already shown, at the first trimester of pregnancy, we already see that more than 10% of participants, and these are pregnant women, are above health guidance values. So it's too late to provide advice to pregnant women. We should be doing this before even they get pregnant. And in fact, we also see from the interviews that the women tell us that they start to make dietary changes if they do that at all, once they know that they are pregnant, not before that. So with regards to how the women prefer to receive their dietary advice for pregnancy, their doctor is their main influencer. So about 82% of the participants said that if new advice for fish consumption becomes available, they would prefer to get it through their healthcare provider. And I also highlight again that by engaging the health sector, we can have a sustainable way of communicating this type of information to women. With regards to what the message should be, we should emphasize the benefits of following appropriate advice for the baby, as well as for nutrition, in addition to safety. And we have relevant information from the interviews that we conducted with the women to support this. So with all of that background, here I present the strategy that we followed to develop and communicate advice to the pregnant women in the frame of HBM4EU mom. Our central theme was that fish is good, eat good fish. So this here is a leaflet we created to help us streamline, to harmonize the message across the 5 countries. So we explained to the women the benefits of having a healthy diet during pregnancy, and that this diet should contain fish. And we explained the reasons then, in terms of nutrients, but then introduced that some fish may contain mercury, which is harmful to the baby, and that this risk can be controlled by controlling the species, portions, and frequency of fish consumption in an appropriate way. And in terms of communicating what exactly the women should be doing in terms of fish, we utilized the traffic light system, whereby the green denoted fish species which are good choices to consume because they're low in mercury, whereas red was used to highlight species to be avoided. And one important novelty of our study is that we strived and worked very hard to eliminate conflicts in the classification of the species across the 5 countries. Here on the right-hand side, you can see wallet cards that were used in Spain and in Cyprus to communicate the advice using the traffic light system. And I should also tell you that we received evaluation of the materials we created and this strategy from the women, and they gave us very high marks in terms of the usefulness of the information provided, the clarity, as well as the amount of information. I don't have time to tell you a lot about the channels we used to communicate the advice, but I prefer to highlight that one very important aspect was that we were able to use human biomonitoring in the second phase of the measurements to validate whether following the advice that we provided can keep the women safe. And what we found is that this is indeed the case, but it's also very important to know that it's critical to empower the women to follow the advice. So we had women who followed the advice and were below safety limits, However, we had also a lot of women who didn't follow the advice. And some of the reasons that the women gave us for not following the advice was in the case of not eating enough fish, they said many times that they had nausea. Other aspects was how easily they had access to fish choices that they could control, but also resistance to change. And all of our results pointed to the need of empowering the women and having ways to persistently express the advice to them. Here on the right-hand side, I show you a poster we created in Cyprus based on the results of HPM for EU Mom to promote the fish consumption advice at the national level in an appropriate way in maternity clinics and at societal level. So our experience shows that you have to be very concise, to the point, you have to have a positive message, and you have to easily tell people why they need to get your attention, why it concerns them, what they should do, and it should be short and to the point. So as a final slide, with regards to how to sustainably use the results to prevent fetal exposure, I should tell you that our participants and their doctors received their personal results, which was a very strong educational action. With regards to the collective results, we used the results to create a range of communication products. By the way, you can read more on HPM4EU outputs on MOM, but also the other activities, and we had a lot of activities on Mercury on our webpage, where there is also a policy brief targeting the policymakers at European level, and of course, opportunities like this one to provide input to inform policy at European as well as international level is something that we strive for, and we thank you for this opportunity, Isago. With regards to exploitation of the results at country level, the countries promoted the results of the study at the level of their governments and societies. In Cyprus, we didn't have fish consumption advice at all. And so in the frame of HPM4EU Mom, we created our first national advice, which was actually made official by the Ministry of Health. And we found ways to promote the message in the health sector. And what helped a lot was to create suitable tools, like the posters you see, which was made available in Greek as well as in English in Cyprus. All of the countries provided tools in an appropriate way at national level. You can also see here that in addition to the fish consumption information, in the frame of MOM, we gave some information and guidance to people with regards to dealing with accidental mercury spills from broken thermometers or energy-containing lamps at home, because again, during the interviews that we conducted, we found that there is a lot of ignorance on this subject. And so not just our participants, but the health sector as well as societal level now has access to this information that was created in the frame of the project. In the case of Cyprus, I should say that we heavily engaged the Ministry of Health to inform the health sector about the advice which was created and validated in the frame of HPM4EU Mom. And this helps to sustainably provide this information to the pregnant women. And it also highlights the strength of having this cooperation of the policymakers with the scientists for the uptake of the results of this type of projects. And we are also planning in the next year to run a social media campaign so that we also widely disseminate the results at societal level. And with that, I would like to finish by thanking the pregnant women who participated in the study in Iceland, Portugal, Spain, Greece, and Cyprus. as well as to acknowledge a large number of excellent scientists in five countries that are under study and five more, a total of 10 countries that were engaged in the implementation of HPM for EU mom. Thank you for your attention.
Thank you. Thank you, Andromachi. And I very much look forward to the progress of your of further work of the HPM for EU. There are some questions in the chat. So, Andromachi, if you can just you could react in the chat box. And in the chat, there's a question about the FCA. I think it stands for the Fish Consumption and Advisories, and of course, if the environment becomes mercury free, there will be no need to for the FCA for mercury, but if we stop the mercury emission today, it may take decades and even centuries for the level of mercury in fish to come down to a lower level. So perhaps the risk communication, we cannot move away from the risk communications. And also there's a question about the dental amalgam. And now I would like to pick up another one of the other exposure route, uh, um, which is the exposure from the skin lightening creams and cosmetics. And I'd like to introduce Ashley Bastians, who wrote the paper on the exposure from the skin lighteners when she was in McGill University, and now she works in the group of Earth observations. And one thing to note is that she also worked with the Minamata Convention Secretariat as an intern to help us to the conference of the parties. So welcome back, Ashley, and floor is yours. Ashley, I going to share a screen, or
Yes,
I can share it?
I
Okay.
can share my screen.
Okay.
Can you hear me?
Yes, I hear you.
Okay, perfect. See. Okay, can you see my screen?
No.
No? Okay, wait, let me just share. Okay, what
Yes.
about now?
Yes. Now it's yes.
Okay,
I see.
perfect. Okay, I will get started. Hello, everyone. My name is Ashley Bastians, and yes, I just finished my master's at McGill University, focused on mercury exposure and the health risks associated with the usage of skin lightening products. And I'm really grateful to be back here. It's a full circle moment because I used to be an intern at the Secretariat in 2019. So I was able to continue my work with mercury over the past 2 years. And I'll just give all of you a little background on what my research is focused on. So there are several forms of mercury, and inorganic mercury is one of the main active ingredients in skin lightening products. And the usage of these products is practiced worldwide, especially within African, Asian, and Caribbean nations. And these products exist in various forms, the most conventional ones being soaps, creams, and some more new ones, including gels and scrubs, some different pills as well. And it's actually become one of the fastest growing beauty industries. It's set to reach about over 30 billion by 2024. And so mercury in these products is banned in many different countries, including Canada, the United States. And the Minamata Convention, Article 4, has set a mandate of banning or prohibiting the manufacture, the import and export of skin lightening products containing mercury concentrations above 1 part per million. But however, there are a lot of different regulation challenges that still exist because these products are so informal and it's a decentralized market. There are different ways to get them both online and in markets in their respective countries. And so there's a gap in our knowledge, which is there's a lack of understanding surrounding the level of human exposure to mercury from skin lightening products. So the objective of my research and specifically of this study was to increase our understanding of worldwide human mercury exposure from skin lightening products. And so I achieved this through a systematic search of peer-reviewed scientific literature. So we searched in 4 different large scientific databases using Boolean searches, and we were able to identify over 2,300 unique scientific articles, 41 of which we deemed eligible for inclusion after iterative screenings of the title, abstract, and at the whole text level. And then we broke down each of the papers into 4 different groups, being semi-quantitative and quantitative. So we were looking at mercury concentrations within products, as well as mercury within human biomarkers of users. And then the semi-quantitative groups, which were the usage frequencies of products, as well as the associated health impacts. And so what we were able to find was that in these 41 scientific papers that were included, we were able to gather information from 787 skin lightening product samples with a pooled central median of about 0.49 micrograms of mercury per gram. So this was the overall central median of the mercury level within all the products that we sampled. And as you can see the breakdown here, which is of the 787 products, there were a majority of creams. Then secondly, it was soaps as well as facial creams and then other products. We were also able to gather about 1,042 human biomarker measurements from 863 individuals. And then we were able to synthesize usage information from 3,898 individuals, as well as self-reported health impacts from 882 individuals. And so here is just some findings. So of the skin lightening products that I had mentioned earlier, the highest median concentration of mercury in products were purchased from Southeast Asia as well as the Western Pacific region. So as you see, I have 2 graphs here. Graph A is looking at where products were purchased from within these WHO regions. And then product A was where they were manufactured and B is where they were purchased. And so when we were looking at all of these, the geographical data gaps were evident, and there was a lot of absence from Europe, Southeast Asia, and Latin America, which are regions where there are known skin lightening users, and more specifically, skin lightening products with mercury within them. And so as you can see here, the median concentrations of the Southeast Asian region and the Western Pacific. And then here is a table of the human biomarkers of exposure. So using the background population exposure or background population exposure or mercury levels of background populations from the Global Mercury Assessment published in 2018. They had their limits were, or their reference levels more specifically, were less than or under 5 micrograms per liter for blood, 2 micrograms per gram of mercury in hair, as well as 3 micrograms per liter of urine. And so as you can see here, most of the users that we found in our studies greatly exceeded these aforementioned values, as you can see here. So the total mercury concentration range for urine, if you can see at the top here, they were greatly they greatly exceeded 3 micrograms per liter, going upwards of 770 micrograms per liter. And then, so some of the health implications, these were some of the self-reported health outcomes from individuals from the United States and Hong Kong. And they had reported things like nervousness, headaches, fatigue, weakness, depression, all things that are associated with mercury poisoning. And there were also, we found a lot of health implications on users of users and family members and people that were in close proximity to users. So, for example, children that were in shared sleeping spaces, or children that were still breastfeeding. And so, to our knowledge, this was the first systematic literature review characterizing the amount of human mercury exposure through the use of skin lightening products. And what we concluded was that although concentrations varied across regions, we estimated that for 1 year of usage, based on this calculation below, users were exposed to about 150 micrograms of mercury. They used it predominantly on their face, about 1 to 3 times daily, and roughly 11 to 50 grams of product per month. So based on the overall pooled median that I had explained before, times 25, roughly 25 grams of product per month times 12 months gives you the sum of 150 micrograms per gram. But again, this is subject to great variation. So if people are using, or individuals are using products with a higher mercury concentration at a greater quantity, this could be exceeded greatly, and vice versa. And then this brings me to addressing future risk. So the goal of the Minamata Convention is to ultimately protect human health. And in order to address the risk of these products, we advise that governments should work collaboratively together to monitor the movement of these products, since they aren't since regulations there needs to be stronger enforcement of regulations that exist, as well as the creation of legislation if they don't exist, the development of inventories, as well as standards for imported products. But ultimately, we need to increase public awareness, because a lot of people in these countries aren't aware of the dangers of mercury added skin lightening products. And that's also mentioned in Article 18, the importance of increasing education. And this can be done through the collaboration with intergovernmental and non-intergovernmental organizations. And then also, there's no national program that harmonizes the biomonitoring of exposed individuals of mercury added skin lightening product users. So this would be a very important tool for countries to monitor affected individuals. And so here's a link to the publication that I worked on, and it's recently been published in the Environmental Health Perspectives Journal, EHP. So if you would like to have a look at that, please go ahead and do so. And I would just like to thank my supervisor, Dr. Nilba Su, who is here, as well as McGill University and the different funders that helped make this systematic review possible. Thank you.
Thank you, Ashley, for your wonderful work. And we have 20 minutes now, and the original plan was to hand over to Milena Horvat of Joseph Stefan Institute, Slovenia, to convene the panel discussion. But I was informed that she's on mission now, and she had to change the travel, and she's now in Frankfurt airport, so she will not be able to join. So if I may, I would like to continue convening the discussion. And we have 20 minutes for panel discussion, but plan is that we are going to invite Irina and Harshka to provide the perspectives from WHO and ILO in 5 minutes each, and then we have 10 minutes discussion. So first, over to you, Irina.
Good afternoon, good morning, colleagues, depending on your geographical location. And I would like to say that a lot of things were already reported through a session organized by SACO and colleagues. So I will do my best to draw your attention to some very important principles of risk communication. You know, communication of health risks. This is common work in WHO because this is the big part and this is what we are doing. So I think the advantage of that is that WHO provide professional advice based on scientific knowledge and what and how can be done. We have clear mandate, getting back to Mercury, from Minamata Convention. This is Article 16. Education, communication, which was further development in the WHO Resolution 6711 on Minamata Convention, which clearly stated to promote effective risk communication strategies targeted at vulnerable groups such as children, women of childbearing age, and especially pregnant women. So our target population is defined by World Health Assembly, which encouraged member states to take relevant actions. So, risk communication. The first 2008 UNEP WHO publication on identifying of population at high risk to mercury exposure. And there is an annex, step-by-step development of risk communication strategy, the risk of methyl mercury related to fish consumption. Then the standard operating procedures, how to communicate risk based on the HBM results. And the final, what I would like to mention, this is the video in YouTube on skin lightening products, and I will say a couple of words about this video later. Just providing an example, it is from 2020, and today, preparing for our meeting, I just went through the comments, and it is really very interesting observation. So a couple of words about the principles of risk communication from WHO. We consider that risk should be communicated by professionals, and that's why we are talking that communication officers, communication specialists should be invited in order to develop the proper communication messages, or it should be very well trained staff with medical or any other relevant education. The person who communicates risk should be very trustful. And in this context, I just would like to provide one example. We organized a meeting for chemical risk communication to people, and it was the common opinion, 100% opinion of participants, that the most trustful people are medical doctors. People do not trust governments, people do not trust mass media, but they are completely open to get message from the medical doctor, and I think it is a very big advantage. A couple of words about the goal. Goal of communication should not be only to provide information. We need to plan in advance what we would like to achieve. For example, for fish consumption, it should be change of their nutritional habits. But for skin lightening cream, we are talking about refuse from using skin lightening creams. So it is like, you know, the goal should be actions more than just providing information to certain population group. And also, there is some different with the sources of mercury. When we are talking about fish consumption, of course, it is individual, the most powerful nowadays, and what we can achieve in short terms. This is their advice to individuals, talking with pregnant women, that really can be done by health professionals. When we are talking about skin lightening cream, we are not talking specifically about mercury. We are talking about hazardous chemicals in skin lightening creams. And you know, I mentioned this video. The main motion is that accept your skin because it is beautiful. There is no need to do whatever else. And that means that if people stop using skin lightening creams, it will be not only decreasing exposure to mercury, but also to other hazardous chemicals. And maybe final, what I would like just to mention, if we are talking about fish consumption, using mass media, knowing how many factors influence on the body burden from methyl mercury body burden from fish consumption, we can cause, let's say, not panic, but negative effect. People will stop eating, some portion of people will stop eating fish, which we would like to avoid, because fish, there are so many very useful and sufficient nutrients in fish. So people should continue eating fish, but at the same time to take certain measures in order to reduce exposure to methyl mercury. So that's why we are saying that message should be balanced. We don't say do not eat. We say eat safer. I mean that we need really to provide the message about benefits and the negative impact. So communication is very complex science. Communication should be really very carefully planned. And WHO provide the good advice on communication of mercury health risks in different settings: ISGM, dental amalgam, skin lightening cream, eating mercury in fish. Over. Thank you.
Thank you, Irina. Wonderful. I look forward to your the further contribution from the radio and in that regard. And then Harshika, over to you.
Very much, Aisaku. Can you hear me well?
Yes, very well.
Yes, great. What a pleasure to be here with all of you. And thank you very much for the organization and to the panelists for the very interesting presentations. So my name is Halska Gracek and I come from the International Labour Organization. So I hope that in 5 minutes I can bring you also a bit of a complementary view to mercury exposures and to risk communication and what that means for the world of work, for workplace exposures, and for occupational safety and health. Because of course, the exposure pathways will be different, thereby the risk communication modalities will also be different. So I think it's imperative that we're looking at the public health measures, and they're of course critical when we're looking at fish consumption, skin lightening products. But when we look at the instruments like Minamata that ask us to look at a multidisciplinary approach, that ask us to look at many different ways of exposure, we must consider the millions of workers around the world that are, of course, exposed to mercury. Mining alone, we have estimates of 19 million miners that may be exposed to mercury. So these are huge numbers, huge populations, and they're not only linked to mining. Of course, we have e-waste, we have chloroalkali industries, we have dozens of different economic sectors where workers can be exposed. And this is very important to recognize because we have developed mechanisms and modalities for responding to this occupational safety and health crisis. The first one is more of a legal mechanism through the implementation of conventions. We have ILO Convention 170 on chemicals, or Convention 176 for the mining sector. And what's important to note is that the OSH instruments, our ILO OSH conventions, include information about risk communication. How can we communicate to the workers about the risks, the chemical risks that they are exposed to? Not just mercury, of course, but many other hazardous chemicals. And this creates a very important platform between employers, workers, as well as other stakeholders, whether that's the government, the Ministry of Labor, occupational physicians, OSH institutes in the area. It creates a platform of being able to exchange through social dialogue key messages when it comes to hazardous exposures. So the ILO promotes that exchange of information, which clearly encourages also risk communication. So this is something fundamental that the ILO pursues in all of its member states, ensuring that we have active social dialogue at all levels, and especially at the workplace, to communicate things like mercury exposure. Another mechanism I really want to highlight here is the importance of occupational disease lists. Now, Irena mentioned the importance of risk communication coming from medical professionals. Absolutely agreed. This is something that ILO has also seen in things like occupational disease lists. So since 1925, the ILO has included mercury-related diseases in its occupational disease list. This is a gold standard for all countries around the world to adopt. So certain countries have included mercury-related diseases as an occupational disease. Now, this is critical for things like reimbursement mechanisms, insurance schemes, but also prevention. So once a country can recognize mercury-related diseases as occupational, there are then, of course, snowball effects that could come after, whether that means prevention campaigns from insurance companies, from employers, or training of occupational physicians. So then occupational physicians can properly diagnose mercury-related diseases in the workers. So this is a critical mechanism, and it's something that we've been promoting in our most recent publication. We've produced a publication on mercury exposures in general in the world of work that I can share in the chat here, but also very importantly, diagnostic criteria for medical professionals. So occupational physicians can access diagnostic criteria for mercury-related diseases. So this is very critical. So maybe I'll close on the idea of what I started with, the idea of having a multidisciplinary approach, ensuring that we're looking at public health, but also occupational health, making sure that we're talking to different stakeholders, both at the national and the workplace level, to ensure that risk communication can really be as efficient as possible for the specific exposure pathways that we're looking at. So thank you very much. And maybe we'll open it to some questions now if there's any participants that have questions.
Thank you. Thank you, Harshka. And the participants, please, if you have any questions, please put that in the chat. And we very much appreciate the reference to the technical scientific materials from the WHO and ILO, and perhaps it would be very helpful if we can include that kind of link in the slide deck that we're going to upload on the website, and also the recording will be uploaded on the website. Thank you very much, and we only have 7 minutes, and so I think that the best thing we can do is just to give 1 minute to all the speakers to present your thoughts, and perhaps you can say anything from you felt from this session, but my thinking is that we in planning this event, we tried to reach out to the experts in developing countries, but sometimes they are not available. Sometimes it is quite challenging for them to participate. So as convention secretariat, we would like to learn from your advice on how developing countries could address the risk communication challenges with limited resources. But of course, you don't need to limit yourself to this one. And I think I will reverse the order. So sorry, Ashley, for bringing you the top. But I will invite Ashley, Andromachi, Eva, Neil to speak for 1 minute, and then Irina, Harshka, and Joy, and I will close. So, Ashley, do you have any thought?
Oh, yeah. So just to clarify, you wanted me to speak for a minute on risk communication of.
Yes.
Okay. Well, so thank you, Irina and Helshka. That was very interesting to hear from both of you. And I think that in terms of what I was discussing, which was the movement of skin lightening products, or the global movement of it, I think the best way to combat risk of, or the best way to combat the movement of these products is through regulations, which is why the Minamata convention is so important. But I think we need to keep looking at the effectiveness evaluation, or evaluating the effectiveness of the convention in terms of the import and export of these products. So I think it comes down to, like I mentioned before, coming up with some sort of national biomonitoring network, as well as working with border officers and educating, yes, like different, yes, people that are actually working to prohibit the movement of these products, like working with these within the, like, global south, within the developing world, to find ways to better regulate these products, because they are still available on the black market as well as on the internet. So I think that it's important we need to find out ways to first educate the public, as well as control the movement of skin lightening, mercury added skin lightening products.
Thank you. Thank you, Ashley. Andrumachi. I think you're on mute.
Yes, now my mouth closed for a moment. Um, I would like to thank Irina because she made some extremely useful comments, and she gave us the opportunity to be reminded of all the excellent work and very important streamlining that the WHO is doing. And in fact, when we designed the HPM for EU mom study, I have to acknowledge Irina for giving us a lot of information, and we reviewed all of that material, and it was used as a background. I would like to also mention that indeed communicating risks is a very serious responsibility, and it has to be taken with that in mind. So in our case, we also involved an external human nutrition expert to help us formulate the way we wanted to express in a positive way the message of promoting fish consumption, but in a safe way. And I would also like to point out that this campaign needs to be country tailored because, for example, we find that here in Cyprus, despite being an island, there are a lot of people who don't eat enough fish. And we needed to keep that in our strategy so that we push for more fish consumption. Whereas in Spain or in Portugal, where they may eat fish 3 times a day or even more, and you find it in all menus in all restaurants, and even they sell cans of fish in the streets. There, the strategy indeed maybe should emphasize that maybe during pregnancy they need to decrease the frequency for the pregnant women. So again, it's not the one solution applies to all cases. I do want to second the fact that health professionals and the medical doctors in particular are the most appropriate people, not just because they are the ones trusted by the women, but because, as Irina pointed out, medical professionals are also trained to communicate risks. So they have the basic skill of doing this in an appropriate way, and they need to have the tools and also the understanding of what the message that needs to be conveyed is. And what we also found is that in the case of the HM4 EU-MOM study, it was extremely important to make sure that there is one message in the country that is their go-to message in terms of what to advise. Because, for example, here in Cyprus, with no national advice, one doctor was telling women they shouldn't eat salmon, another doctor was saying they should. A doctor was saying you may eat canned tuna, another doctor was saying no. Women may, everybody has access to the internet nowadays, and the more people are educated, they look things up on their own, and there is a lot of conflicting information out there. So we find that really letting people know an official message is very important.
Thank you.
And the last thing, and in closing, I should also second the fact that in terms of not just the skin lightening products, but for example, we asked women if they have tattoos, and I think it was maybe 40% of our participants have tattoos. So I am in a laboratory that also controls the chemical safety of products, and there are a lot of tattoo inks that are being notified in the European Union because they contain carcinogens. So again, it's this issue of, we are trying to help people protect themselves and their babies, but maybe there are simple things that they need to be doing to protect their health without compromising their nutrition, which are maybe even easier to address. So what I'm saying is that, again, it's a complex issue, and having proper tools and a strategy to convey this information to people is very important. Thank you.
Thank you very much. A huge challenge indeed. Eva.
Yeah, thank you, Asako. I think I'll just briefly mention an idea with regards to what you said about developing countries looking to develop their risk communication, or even maybe monitoring, let's say, for ASGM sites and things like that. And I think it would be really important, first of all, that the research is done in a partnership approach. When you have indigenous peoples, for example. And I think a great example is what we have in Canada with the Northern Contaminants Program. And I think there are lots of examples that can be used to really do the research in a way that the communication, as many have been pointing out, it needs to be really planned ahead of time, and a lot of time needs to be spent on thinking about communication. It's really not a one-off thing that should be just dropped on people, and that trust is important, and you need to build trust from the very beginning. When you plan your research, you need to plan it basically, with the people if you're doing monitoring, for example, and when you then communicate, you really need to know how to communicate it properly. So I think that would be my advice for developing countries, to use some of the experiences that are already there, and look for that. There's a lot of information out there.
Thank you, Eva. And indeed, we are doing this session to share that example. Thank you very much. We are 3 minutes over, but perhaps I have a bit of time to invite all the speakers. Neil? You're on mute. Yeah, he had a bit of connectivity challenge, I think. So, yeah, Neil, please chip in when you're ready to speak, and then I think I will turn to Irina and then Harshka.
So, just summarizing the main point. Effective communication is prerequisite of risk reduction measures. The task is complex, but being prepared carefully, it will work 100%. But you need to answer 4 questions. Why this is your goal? Not to provide communication, but what you provide information, what you would like to achieve providing information. Who will communicate, and who is your target audience? What? The message, which is carefully adopted to the audience, very balanced, scientifically based, but on a plain language. And how? Should it be flyer? Should it be personal communication? So if you consider all these questions at the planning stage of communication strategy, you will be successful. Oh.
Thank you, Irina. Harshka?
you very much, Isaku. So just to close off, maybe I'll add a little bit too to what Irena was saying, because of course we follow very similar risk communication methodologies at the ILO. But one important other step that I would add that's really central to our occupational safety and health management schemes is the importance of evaluation then. The importance of evaluation of the risk communication methodologies. Are things being communicated clearly? Is there some kind of output measurement that we can assess? And for us, that's in the workplace. So usually that would mean a decrease in hazardous exposures, a decrease in hazardous outcomes of diseases, so mercury-related diseases, having some kind of measurement technique to see if the risk communication program or strategy is working in the specific workplace or for others in the public health sphere. So it's something to consider as well as part of that methodology. Thank you.
Thank you, Harshka. And Neil seems to be a challenge in the yes. Neil, can you speak now, or would you like please?
I can try. Can you hear me and see me?
Yes, yes, I hear you.
Great. Sorry, everyone. My internet's been lousy all morning. So I really appreciate the perspectives of all my fellow experts here today. I think if I reflect upon our plenary paper, how we talked about our evolved understanding of mercury risk communication, risk science, these were nicely exemplified in all the presentations today. The idea that we need to make risk communication fit for purpose, but also, as we heard in the last presentation, how we want to be able to promote reflective practices to better engage and evaluate is important. Moving forward, thinking of the convention itself, the issue of education and empowering and capacity building is something that I think will be very important as it pertains to risk communication in many parts of the world in which such practices are better needed.
Thank you, Neil. I think you summarized this discussion perfectly, and I think Joy has left, so perhaps now I'm going to close, and I don't have any substantive message that I can add to all that have been said, and just the only thing is that just a reminder that the Minamata Convention explicitly refers to WHO and ILO, and we expect you to help the parties with us in promoting the health strategies, including the health risk communication. Thank you very much, and I wish you all a good rest of the day, and perhaps the present holiday season if you're ready for that. Thank you very much.